And welcome back to Body Beautiful. I'm Janelle Marie. With us today, we have plastic surgeon Dr. Joseph Mealy talking about all different kinds of procedures, plastic surgery related. So, doctor, we talked about breast augmentation last time. Now we're talking about rhinoplasty. And, you know, people pretty much know what rhinoplasty is. But for those who may not know the name rhinoplasty, what is it?
That's when you change your rhinoceros.
Oh,
no, it's nasal surgery. So we're trying to
How many people have one of those?
Well, it's a very specialized procedure. But no, rhino means nose and plasty means change.
Okay.
So it's changing the appearance of the nose.
And so, this is kind of interesting because a lot of people, if they go in for, they have a pronounced bump, but a lot of people really don't. How do you know when you need one?
It's driven by my patients.
Okay.
Because I don't really walk down the street and go, oh,
you need a rhinoplasty.
That should be fixed. Because everyone likes the way or wants to look a certain way.
True.
And I have patients who everyone in their family has a bump on their nose and will go through the things that they want to modify, and the bump isn't one of them. They want us to look like they belong with their family. But most people don't like it.
Let's talk about picture number one here.
Sure.
Because, I mean, what is going on here? There's
she has
not
a
much.
pretty nose before.
Yeah.
The proportions are good. She has good projection. She has a little bump that really she didn't like.
Okay,
and because she didn't like it, that's why I changed it. So, and you can notice at the tip, I've rotated the tip up a little bit too.
Oh, you did? Oh, yeah.
For men, 95 degrees is probably a good angle. For women, 95 to 105. Usually it's up a little higher. And it also depends on the height. So if I have a woman who's 6'5", I'm probably not going to want to tip her nose up as much.
Because you don't want to look under there too much.
No, you don't want everyone looking up your nose.
So what's the downtime for a typical nose job?
So rhinoplasties usually don't hurt. If someone's having a lot of pain, they should be calling their doctor and telling them, hey, I'm having a lot of pain. Because normally, we move things around, we put a splint on there, and just like when you have any sort of injury in a splint, it's not moving, it should feel good.
Yeah.
So sensation-wise, as far as disability from pain, it should be minimal. But it does often cause a black eye.
Okay, well.
And if you've got a shiner, you may not want to run around town. So.
And do you have to wear a bandage for a while?
The bandage is on there about a week.
Gotcha.
Sometimes there's tapes on a little bit after that. The black eyes last like a normal black eye, 7 days to 10 days, somewhere in that range.
Do people
but some people don't get a bruise.
Oh, really?
Yeah.
Do people go out? Do you have to put them out for this procedure?
I normally do this with people asleep. Yeah, unless it's a little tip, then I can probably do that under local. But most of the time, we want to be asleep, especially if I'm having to modify the bone.
Oh yeah.
I mean, it can be done under local, a little uncomfortable. But even if it's numb, it just doesn't sound right as the patient. So yeah, better to be asleep.
Picture two.
So same idea here. So reduce the dorsum,
not too much there.
Reduce the tip a little bit, and again, her rotation was pretty good, so I didn't want to overdo that.
Very natural on that. Picture number three has a little more pronounced bump there.
Men in general tend to have bigger noses.
Yeah.
And it looks more masculine, so we tend to keep them. But here, he had quite a bit of projection at the upper part. So the top third of his nose, that's bony. And then the bottom third is all cartilage. And that area in between, that's the keystone area, is where the highest point is. So I have to reduce the bone and the cartilage in order to smooth that out.
And there's really no scars on this, are there?
The scar is underneath the nose, like between the nostrils, along that little piece of skin between the nostrils. We call that the columella. So we'll go transcolumella is one approach.
I knew it was the columella. I just wanted to see if you knew it.
Sometimes if we're just adjusting, smaller adjustments, especially up on the dorsum, you could just make the incisions inside and not have to go there.
Because, Barbra Streisand, I think her agent told her to get a nose job. She refused, and it ended up being great for her because she looks amazing with that nose. So you never really know.
No, I mean, what I do is driven by my patients.
Exactly.
And if they tell me they don't need something, they don't need it.
They don't need it.
I don't do life-saving surgery here, so.
What's the next picture?
So same idea. So this is another one.
Is that a man also?
Yeah, kind of an elongated nose, as well as a dorsum bump, but that dorsal bump's a little bit lower. So in this case, the bone isn't quite as projecting, which makes it a little bit easier. When the bone is really projecting, as we take down that side view, from the front, we're making the top of the nose flatter and flatter. And if you go far enough, you'll separate the side from the septum, from the middle.
Yeah.
And you actually have to fracture it to bring them back together.
So you have to break a little bone in there.
Yeah,
wow.
But I don't think people could really tell if I didn't tell them if I'd broken it or not. It's not more uncomfortable, though it is more likely to bruise.
Can this be combined with other procedures? Can you do a nose job with other things? And
Surely. I did a nose job with a breast augmentation.
Really?
Which you might not think are related, but it's just, she thought about doing it. She was now having her breast augmentation, which she definitely wanted. It's like, well, while I'm there. So we combined them. But usually they're combined with facial procedures. Gotcha. A lot of people are doing eyelids, facelifts, and we'll do rhinoplasty at the same time.
And what about working out after a nose job? How long do you have to wait?
So it's really about not causing bleeding. So if you're bending over, stooping, straining, you're more likely to cause bleeding, and that's going to be a problem. Because I'm not going to worry that someone's going to bleed to death or need a transfusion, but if you bleed under that skin, you're going to make a new bump, and it's going to destroy our aesthetic result. Yeah, that's bad.
Final picture.
So here too, this is a little smaller bump. So in these cases, sometimes you can just shave it down and not have to break anything, and it works quite well. I've also refined her tip a little bit, but you can't really see that from the side.
Probably a quick procedure. You just kind of shave the bone down a little bit, you're done.
It is, and with no bruising, she could run around right away.
That's awesome. All right, well, thank you for that. Nose jobs, there you go. If you want more information about this or to see any more before and after pictures, you can call the office 925-943-6353. Go on the web to check out the photos, drmealy.com or sanfranciscobreast.com. All the before and after pictures are there. Everything is on your website because you have a beautiful website, young man. All right, we're going to be back on Body Beautiful talking about more plastic surgery topics. Stay with us.